Hello, this is Dr. Do again. This video is continuously from previous video, systemic approach of medicine. This stream of video layering out the diseases associated with the structures, actually from the invisible compounds to the cells, and move on to the tissues. I have talked about the epithelial tissue and also the connective tissue. I think pretty much this is just the cover what I think important concepts. Could be there's some more in terms of, for example, connective tissue, the cartilage. There'll be more detailed some other diseases like the cartilage disease, or some of the valve or some other connective tissue associated diseases like muffins or essential. But I'm just cover those that I think is quite common or quite serious. That's probably my focus. Or probably I missed some, but I'll just try to make it up later on in the other topics. So today I'm going to move on to another tissue, which are the muscular tissue diseases. Just briefly go back to what I talked. There are only 4 major tissues, like epithelia, connective tissue, and muscular tissue, and nervous tissue. So today I'm going to move on to talk about the diseases associated with the muscular tissue. There are different types of muscles in the body. In addition to, we all know the skeletal muscle, which is connected to the bones and move our limbs and facial expression, and also the bodies and support the back and abdominal. So this is the skeletal muscles. And there are another type of muscles, smooth muscles, which are in the internal organs like the digestive system major, and also around the eye. For example, there's some smooth muscle to contract to affiliate with the refractory function of the eyes, and also some other structures, the gland, some of the glandular structure associated with this smooth muscles, or the hair follicle, for example, also have those tiny, small, probably just a small structure of the smooth muscle affiliated with this erection of the hair. So these are, and the major of smooth muscle, majority of them are found in the digestive system, from the esophagus, stomach, and small intestine, large intestine. So that's where the smooth muscle found located. The smooth muscle has the unique feature compared to the skeletal muscle or cardiac muscle. So the diseases with this smooth muscle really, I think it's probably I'll just focus on the digestive system diseases. The motility of the stomach or the intestine. Particularly, there's one disease I can think about is the ileus, which means the dynamic obstruction of the small intestine occurred in those older people, or abnormality of electrolytes, or just not those people who do not have regular bowel habits. So these are probably the risk factors of this decreased motility of the smooth muscle associated with the obstruction. That quite, especially in those long-term bedriding, without symptoms, without signs, because they're bedriding and without movement, and so eventually develop this ileus. Is quite dangerous, could be life-threatening, because the expansion of the small intestine cause the pressure, sometimes may cause perforation. So that's, if that's the case, it's really cause peritonitis, infection, and expanded quickly actually to the infectious toxic shock, and then life-threatening situations. So the risk factors, as I mentioned, chronic diseases, electrolyte imbalance, long-term bedriding, and not good bowel habits. And so these are all the risk factors, particularly for elderly. Of course, on top of that is not liquid, not intake enough liquid. So this is about the signs of abdominal pain, and the symptoms is pain, quite painful, and feel extension of the abdomen, and the physician will listen to the bowel sound. Usually, if you're interested, you can get a stethoscope and listen to your bowel sound. probably the 3 to 4, 2 inches next right to your navel. You can hear the vowel sound probably 5 to 6 times a minute. But for those EDS, dynamic obstruction, you cannot hear the vowel sound at all. So vowel sound is vanished. So that's the physician will tell whether it's dynamic versus the obstructive a small instruction or mechanical caused small instruction, which means at early stage the vowel sound is quite active, more than normal. So this is for the medical standpoint, for the nurse, for the physician, that's they will tell. So this is about disease associated with the smooth muscle. Either regardless of the small intestine, stomach, or large intestine, the other disease associated with this is the perforation, which means through the muscular structure, the whole digestive wall was perforated, either caused by the ulcer going deeper or the cancer. The tissue was undergoing inflammation, fragile, and caused the perforation. That is also emergency, regardless of where it's located, either stomach or duodenum or small intestine. That's feel the suddenly abdominal pain and are not unalleviable, cannot, no matter what you do, cannot feel better. May or may not associate with either black stool or vomiting blood, but if that's the case, if you had a history of ulcer, if you have a history of cancer, or if you do not know you have a history of cancer but you're losing weight regardless how much you take, if that's the case and suddenly develop this abdominal pain, do not hesitate, go see your physician, emergency as soon as possible. So this is about disease associated with the smooth muscle. The skeletal muscle associated disease, I think the trauma injury is the most common one. The strain or the bruise or twist your muscles. We always use these words, and that's just a mild injury. And a severe injury could be the rupture of tendons or the ligaments. Actually, ligaments is not associated with the muscle, but so that's the muscle torn. That's probably one of the most common diseases associated with the skeletal muscle. And on top of that, myositis may or may not occur in muscle. Just the infection causes this skeletal muscle infected. It's not common in healthy, but for those who had chronic conditions like chronic peripheral neuropathy or the chronic ischemic condition can have this skeletal muscle infection. And on top of that, I think that's the one of the other important serious condition which occur in the cardiac muscle, which is like one of the 3 types of the muscle tissues. Of course, this the notorious, the most fearful is the infarction. I'm going to leave that to next topic. I think that's probably just briefly connected to the structure, fundamentally structured to the clinical diseases, and hope that it can remind you if you have those problems or can trigger your interest to search more. So I'm going to, and also to talk to your physician if you have concerns. I'm going to stop here today, and thank you for watching. I'll see you next time.